Recently, we hosted a side event with partners from the Asia Network to End FGMC, and we highlighted recommendations to the government of Asia to take 3 key actions.
As you all know, under the 12 critical areas of concern of the Beijing Platform for Action, governments have a duty to end all forms of harmful practices. So in terms of crucial steps, firstly, what I would like to say is that governments need to collect accurate and comprehensive data, statistics and evidence, and I think this is a message that's been coming up like in every session during the CSO forum, and also we've been hearing a lot during many of the side events today. And we need these evidence to help understand the intersecting driving factors, power inequality, socioeconomic factors, and also environmental factors such as climate change, all of which drives harmful traditional practices like FGMC and child early and forced marriages. And all of these data is also important to understand the impact, scale, and implication of these harmful traditional practices on the sexual and reproductive health and rights of women and girls throughout the course of their lives, but also including in their early years and during adolescence. And it's also an understanding that can better inform strategies, community-level action, and legal and policy reforms to put a stop to FGMC and child early and forced marriage against women and girls. Without reliable research data and statistics, it will be hard to plan appropriate interventions or measure their effectiveness. The absence of official data it has far-reaching implications because it affects funding in this region towards efforts focused on eradication of these practices. For example, funding for FGMC is insufficient for this region, and one of the reasons for that is the lack of awareness that we have on the prevalence of FGMC in Asia. Secondly, in response to your question about legal reforms, so governments in Asia need to introduce necessary laws and policy reforms that effectively end both FGMC and child early and forced marriage. For FGMC, a majority of countries in Asia have received recommendations from treaty body processes as well as during universal periodic review processes to address the issue and pass specific laws prohibiting the practice. And we urge these countries to implement those laws and implement those recommendations that they received from the treaty bodies and the universal periodic review processes and prohibit FGMC. On child early and forced marriage, while most Asian countries have taken steps to put in place law or they have undertaken reform in laws, in fact, there is a data that I have come across that shows that laws of 37 countries in the Asia-Pacific region address the issue of child early and forced marriage. But the problem is that despite these laws, there are gaps in the legal and policy protections, which allows harmful practices such as child early and forced marriage to continue. For instance, in many countries, the personal or family laws applicable to minority communities, they have a lower standard of protection, where there is no minimum age of marriage prescribed under the law. Again, in a lot of other countries, some of the laws, they retain exceptions. So these exceptions, they exist in legal provisions permitting child early and forced marriage with dispensation, parental consent, and or local authority approval. Therefore, governments need to strengthen legal frameworks on child early and forced marriage without exceptions to better protect women and girls from this harmful practice. And the last recommendation, governments in Asia need to commit adequate resources towards ending both FGMC and child early and forced marriage, and use those resources to adopt a holistic, comprehensive, rights-based, gender-responsive national level strategy action plan and interventions that are localized and contextualized. Such plans should also build social support networks and raise awareness through community engagement. And this should include the involvement from traditional and faith-based leaders and meaningful participation, of course, from girls, adolescents, and youth in all their diversities.
Hi, I'm Arifa Johari from Mumbai, India. I am a survivor of female genital cutting, and I'm also the co-founder of Sahyo, an organization working to end the practice of FGC in Asian communities. In my experience as a grassroots activist, I have come to understand that female genital cutting is many things. It's a harmful social norm, a religious practice as perceived by communities, a human rights violation, and it's also a sexual and reproductive health rights issue. In India and in many Asian countries, FGC does not often get recognition as an SRHR issue, but it must. First, let's not forget that sexual control is the main reason why communities tend to practice genital cutting. Many survivors struggle with sexual intimacy in adulthood. Second, FGC is getting more and more medicalized in Asia. This means that little girls are increasingly being cut by doctors and other healthcare professionals in sterile medical settings, even though this is a non-medical ritual that can be harmful to female sexual and reproductive health. In fact, in my community of the Dawoodi Bohra, many of the doctors that carry out FGC happen to be gynecologists. Unfortunately, in most Asian countries, there is no official data on the practice or prevalence of FGC. While grassroots NGOs like mine have conducted some prevalence surveys, the data is not acknowledged by governments or medical bodies. Some medical associations, like the Federation of Obstetric and Gynecological Societies of India, do condemn FGC as a harmful practice, but almost nothing has been done to include FGC in national SRHR policies across Asia. Nothing that can prevent girls from being cut. So I urge you today to take action, to do more as leaders, to recognize FGC as a sexual and reproductive health rights issue, and to create policies that will help to end this practice.